to Bern benefit ratio. I will give you to everybody one of this that you understand a little bit what this means. We have heard just before around that the BAHA since more than 20, 30 years is on the market. The question is every time when you want to use a single-sided deafness, when you want to use the BAHA, the criteria, this is very important. And I show you a little bit our experience in Bern about the BAHA system. Is optimization of indication, optimization of fitting, speech understanding and noise, this is very important, also in Italy it's very noisy, sound localization, comparison with other forms of therapy. What we have seen, this was 2009, we have performed 326 cases of BAHA percutaneously. We have had 55% of bilateral combined transmission hearing loss, 28% of unilateral, and only 70% of cases, what is the topic in fact of these courses, of single-sided deafness. Who decides for a BAHA? How can we optimize the fitting? We have, what we have seen, also other groups have seen that less than 20% of patients have a single-sided deafness. We have congenital single-sided deafness, probably more than late acquired deafness, was a publication by Martin. We have one important publication was from Stanford about what happens transcranially, the attenuation. We have a low attenuation transcranially, and this is very important when you use then BAHA to look also what happens in the bone. Our own study compared 46 adults with single-sided deafness candidates for BAHA. 7 to 10 days, you have a pointer, or here is a pointer? No, okay, here, sorry. And, 29 decided for a BAHA, 17 against BAHA. And we have analyzed, in fact, the difference in the both groups of decide yes and decided no. The influence of age, we have seen no difference between one of 20 years or 80 years. With the sex was no difference, there was no gender politics. And we have etiology, was not obvious influence. Here we see the reason why it was supported to make a BAHA, sudden hearing loss, infection, trauma, acoustic nerve, posterior surgery, or otosclerosis. What we have seen, no influence of etiology of deafness, mean hearing level of the good hearing ear, the remaining hearing level, and the transcranial attenuation. Here we see the age up to 1 year, up to 50 years. This is this transcranial attenuation in the two study groups. So we have BAHA chosen and BAHA decline, and this was a small attenuation by Stanford. Have seen more profit. Our own data have shown us there is no significance in the attenuation of the bone structure. Now we have then decided how we can do something. This is only one possibility. There are other groups worldwide. They look how we can make indication to have a happy patient after the operation. And this I think is very important. And we have 10 questions to the hearing situation, visual scale, comparison with and without hearing aid, help for the candidate for the evaluation of the subjective profit. And this is now disposable in 11 language, and you can also free download this. And we will quickly go. Then you have received, I have given you this in Italian. You find also this. What is important to know what kind, there are normal questions that you have. What is important that you use this headband, and then you're looking about how many is the score. And we have decided that 15 or more are for BAHA. What you can on this 10 questions what you have, and 10 or less is against BAHA. This is what we have found, and it's clear we find every time a gray zone where sometimes it's for BAHA and sometimes against. And therefore you can use this, you can read it, and you can use it for your patient